Six, the COVID-19 pandemic is putting a lot of stress on everybody, and especially for those who are battling opioid addictions. They're being hit especially hard. Sheba recently sat down with the state health official to find out about the help that's available for addicts while they're at home.
Tens of thousands of Americans die every year from opioid overdose. And some experts are saying that this pandemic could fuel the next wave in the opioid crisis. Dr. Joe Kanter, the Assistant State Health Officer for the Louisiana Department of Health, is joining me now to talk more about this conversation and the resources that exist that could really help that people may not know about. So, Dr. Kanter, thank you so much for joining me.
Thank you, Sheba. It's my pleasure.
Yeah, this is a huge problem, and the numbers always show so many people.
It is. And one of the concerns with the COVID outbreak is, number one, people are deferring other types of healthcare. So they might not be addressing addiction, for example, in the way that they would have otherwise. And also, this is a traumatic experience for all of us. I mean, it's such a traumatic event, and there's a concern that it might incite addiction issues in people that otherwise might not have had them. So we know there's a big need out there. We want to make sure that people that have concerns or having challenges are connected with the resources that are available.
Yeah, that's one of the big things I've read about, that a lot of people who would be going to counseling, kind of getting some help with this, are now already stressed, lost that face-to-face counseling. But I understand that locally there are still resources.
There are, and I'll run down a couple really good ones.
Great.
And when we say resources, we're talking about medical providers or other clinics that can help people work through addiction. And that might be through medical therapy like buprenorphine or Suboxone, or it might be counseling or some combination thereof. So one really good one is at University Medical Center. They have an integrative medicine clinic where they can provide both primary care and addiction treatment all in the same clinic. It's really good. It's still open now. They're doing both televisits over their computer or phone and in person, depending on what works best. And the phone number for that clinic is 962-6110. One other really good resource is Odyssey House in Louisiana. They have a beautiful new space on Broad. They're also doing a variety of services, both residential in their facility and outpatient. They're a great resource too. They have a good website with more information, and that's ohlinc.org.
Sure. I've also read that some health experts are worried that people who suffer with opioid issues could be at an increased risk if they do get the coronavirus, because they could have other health issues.
You know, addiction makes everything more challenging. It makes treating any other medical problem that much more challenging. And sometimes we see in medicine that if the addiction doesn't get the appropriate attention that it deserves, that everything else falls apart on the back end. So if people are sitting at home and they're worried about opioid issues, or they have a loved one who is going through some challenges right now, we do not want people to be by themselves on this. We don't want them to defer going in and getting help. There's really good help out there. And just because we have COVID going on doesn't mean that the resources are not available. It just sometimes takes a little bit of finding them. But the UMC clinic, the integrative health clinic there, and Odyssey House, really good resources. People don't need to be alone through this.
No, they certainly do not. And thank you so much for providing our viewers with those resources. Dr. Joe Kanter, thank you so much for joining me.
Thank you, Sheba. My pleasure.